Welcome and thank you all for coming. My name is Amber Gillis and I am the CEO of the Anxiety and Depression Association of America. Today I have come here to present to you a presentation on anxiety and panic disorder in the workplace. And today we are going to be discussing the different factors of anxiety, the complications, symptoms of anxiety and panic disorder, techniques that you can use in the workplace when you feel an anxiety or panic attack coming on, and your rights under the ADA, which is the American Disability Act. Here is a chart that lists the different factors that contribute to anxiety and panic disorder, and some of those include excess caffeine, excess alcohol, use of illicit drugs. Also, if you have an untreated psychological disorder, that can contribute to anxiety and panic disorder. If you have a medical illness or if you are taking a medication, anxiety or panic can be a symptom of that. Also, many individuals do get panic or anxiety disorder if they have a blood relative that too has been diagnosed with that. If you do have a substance abuse issue, then that will need to be treated before you can have your anxiety or panic diagnosed. And here is a pie chart that lists the different complications due to anxiety, and some of that is depression, muscle tension, irritable bowel syndrome, suicidal thoughts, insomnia, and headaches. And a lot of that can be caused just from panic alone. If you're panicking, that can be a very debilitating feeling, and that can cause you to feel very depressed. And there are some people where they can't, handle those feelings, and so they start to have suicidal thoughts because they don't know how to overcome that issue. Other symptoms or complications due to anxiety include lower immune system, fatigue, and high blood pressure, and once again that is due to the anxiety and panic. When you are panicking like that, your immune system, the antibodies aren't able to fight as well as if you were a normal, healthy American. Symptoms of anxiety, here is a chart that lists multiple symptoms. Just a short note that some of these symptoms do mimic that of a thyroid disorder, heart disorder, and breathing disorder, and many individuals who have these symptoms end up going to the hospital thinking they're dying or that they're incredibly sick. And so there are a lot of people with anxiety and panic disorder that are frequent to visit the hospital because they're not aware of their anxiety, and they're not aware that their anxiety is causing these such harsh symptoms. And just to list some of them, you can have dizziness, you can have numbness and tingling in your fingers and toes, you start to hyperventilate, you become short of breath, and you get clammy, and all of that can add to the anxiety that someone has because they don't understand why they're feeling that way. They just start to panic, and in turn that just, isn't good. Here we're going to list the different techniques that you can use when addressing anxiety or panic in the workplace. First and foremost, it is definitely valuable to have a trusted coworker that you can address when you feel yourself getting anxiety or panic. A lot of individuals feel that people won't understand their disorder and they'll judge them, so they keep it a secret for such a long time. And when they do get a panic attack, they make up different excuses of why they can't be at work, and their employers don't understand that. But you have to understand that it's important to let somebody know so that they can help you under those situations. So confiding in a trusted coworker is definitely important. And then just using different breathing techniques, because once again, in the previous slide, it listed the symptoms of anxiety, and a way to, get rid of those symptoms is different breathing techniques, because when you're having anxiety, you feel like you can't breathe, or your chest starts to hurt really bad. And so breathing 5 or 10, really deep breaths can help open up your airways again. Concentrating on an object around you, that can definitely be beneficial, because a lot of individuals who have anxiety or panic disorder get a disassociation, so they don't feel connected to their environment. So just focusing on an object can help recenter that person. Touching different textures, that once again is to help focus your energy and become more connected to your environment than focusing on the anxiety and panic. Buying a water feature or a goldfish. Goldfish definitely help bring peace and serenity into your environment, and it can once again be a way to take your anxiety off of what you're focusing on and put it onto that goldfish. And then just continuing to work, that can definitely be the most helpful, so you can continue to have a good routine. Having a routine is definitely important when you have anxiety and panic, and that will also help you not develop depression or suicidal thoughts. Recognizing your triggers is definitely important, so you know what to expect and how to prevent your anxiety and for those triggers from happening in the future. So if you are adopting a new work schedule, just recognize that you do have a new work schedule and that there's going to be a new routine happening, and then you can start to, talk to yourself about that and yeah. Large crowds can definitely be a trigger for some people. Being around a lot of people can be a phobia for certain people. And also, excess workload can be a trigger for anxiety. So it's just recognizing these things, talking to your employer if you feel comfortable doing so, or a trusted coworker. We're going to talk about workplace accommodations and employee rights. The ADA is the American Disability Act. It was signed in 1990. It prevents employers from discriminating against their employees. A disability can either be physical or non-physical, so it does cover mental disability. Your disability can either be permanent or non-permanent, so that means depression. If there's a family member that died and you all of a sudden start to adopt anxiety disorder, then the ADA does cover that. Your employer cannot ask you if you have a disability, but if you do disclose that information, then they can ask you how you would like to be accommodated. If you need a couple days off to deal with your anxiety or panic, that is allowed under the ADA. You will need to get a doctor's note to show your employer valid evidence that you do have that disorder. But it's definitely important to know what your rights are so that you can feel more confident in the workplace and know that you do have these rights. And just because you have panic attacks or anxiety doesn't mean that you have to worry about your place of employment. So in summary, just remember that it's good to know your triggers so you can know about what's going to happen in the future, how you can prevent that. Reach out to somebody at work if you feel comfortable doing so. Make small life alterations such as cutting down on coffee or alcohol if that triggers an anxiety attack. Don't stop medication abruptly. Adopt helpful tools to ease the onset of anxiety, such as breathing techniques, buying a goldfish, those sort of things. And know your rights under the ADA so that you can feel comfortable in your workplace and know that your job won't be at stake if you have an anxiety or panic attack. And there are numerous support groups out there, so just research that and know that there are people out there that can help you and that understand what you're going through, and you're not alone with this disorder. So I just want to again thank you all for coming here today and hearing my presentation, and I hope that this was beneficial for all of you. Thank you.